Hi, I'm Dr. Molly with Your Goals Physical Therapy. I vividly remember the first time that I downloaded a book or a program rather that was going to get me from running, like no running, like couch potato, right? All the way to running a 5K. And so, or approximately 3 miles. And at that time in my life, I was still in college. I wasn't feeling so good, like physically, emotionally, lots of stress because you're in college, right? And so, but I knew that health was important. In fact, that was one of the degrees I was going for. And so I really wanted to try and get this going. But my workouts were at best sporadic and at worst non-existent, like everybody else's, right? And so I downloaded this program because it was going to tell me step by step how I was going to get to run. And at that time, I couldn't have run 15 seconds without feeling like I was going to die. So the idea that I was going to run 3 miles or 5K was a little outside of my realm of believing, but I did it. I set my goals, I followed that program to the letter, and at the end of that 8 weeks, I believe, I was able to run all the way through that 5K. And I remember the first time that I made it all the way through, I was so excited that I made it, and I still was very nauseated. And it took a little bit of time for me to get past making it to the end of that 3 miles and not wanting to lose my breakfast. But I did eventually get very good at that. And it was wonderful, right? I felt so proud of myself. Running endorphins are amazing. So I always felt super pumped afterwards. So I noticed that I was less tired, I was less moody, I was able to handle more stresses because things weren't bothering me so much. Like a lot of things were doing very well because I was able to do that. And so, so I continued that, and then you end up with like social circles because you do road races, and then you meet some of the same people, and you're seeing the same crowds, and you have the same struggles, and you're asking about all these things. So you end up with these running friends, right? So that you get the social circle, and of course you lose a little bit of weight for the most part if you're good with your diet. And so all of those things were happening for me, and it wasn't until I started to want to maybe go for a 10K, which is 6 miles, so I was just trying to increase my mileage, that I started to have some real big problems. That's when my knee pain started. And so it started kind of mild, right? I mean, I made it all the way through that running program with really no knee pain at all. So woohoo! But then as I was trying to increase my miles, they would get a little achy while I was, like right after I was running, which, that makes sense, right? You just ran, you try to run 4 miles. Of course your knees hurt, right? Your thighs are a little sore. So you ice them, you rest, and the next day you're fine, right? So no big deal, you move on. But eventually what happened is that because I was so diligent about running and felt like I just couldn't stop, for some reason it was implanted in my brain that if I didn't run one day that somehow I would like never be able to run again. And so I just kept going. So even if I didn't run as far, but I had to keep going, otherwise I was going to lose all this ground. And so I eventually, so the knee pain kind of just sort of progressed. So it went from, just being a mild ache and then resolving itself to it lingered. And so then it took 2 days, or maybe it didn't really go away, but maybe once I was running, I was fine. So it wasn't a big deal. But then it would sort of compound itself, and it sort of spiraled after a while. And so that knee pain after I ran started getting pretty intense. And so then eventually I did have to actually stop and take a break because the knee pain was so bad. Like I couldn't walk to class. It hurt to sit for long periods. It hurt the moment I was going to stand. So it was, and then at that point I had to walk up, flights of stairs, and that was not comfortable. And so I did end up having to take a pretty long break, and actually eventually I did have to hang up my shoes because I just didn't have enough bandwidth during college to kind of deal with what was happening with my knees. But this story is having a positive ending. So I am back to being able to run. I don't have any knee problems at all. And so my journey back from being able, from having that knee pain to now being able to run and not have any problems is kind of what I want to talk about, because I know that knee pain is so common when you run. A lot of doctors will even tell you that you shouldn't run because of your knees, right? And so I've looked at a couple different running programs and some things that, you know, my patients have brought to me. And so I've seen a few things that are generally missing from the forefront of those things. So even if they're written in the programs, they're normally like in small print, nobody pays attention to them, me included. And so I just want to kind of reiterate some of those things. So if you started to run and you're starting to get knee pain, either before, during, or after your run, really it's kind of all the same thing, then these are things that I think you should make sure that you're adding into your running program. You definitely need to be stretching. You need to stretch before and after your runs. Okay, it's very, very important for joint health and for just overall health that you stay flexible and mobile. Okay, the other thing is that we don't think about as runners is that it takes a lot of strength to run. So you need to have a strength program in place. Now, I'm not talking about going to like lift weights or, you know, you have to go to the gym or anything, but you do need to do something that is strengthening your muscles, that needs to be a part of your training program. And don't think about it as giving up a running day. You're augmenting that running day, okay? It's going to go with that running, okay? It's not going to take away from your running ability. And then plyometrics. Basically, running is nothing but jumping, right? And nobody ever thinks about training how you jump. And so that is another part that at least needs to be incorporated at, you know, maybe it's a half of your strength day or something. It needs to be added in. You need to practice how you hit the ground. It is very, very important. It helps prevent injuries. It helps reduce the stress on joints. It is so important to practice how you run, how you jump, and how you land. And then if this pain lasts longer than 2 or 3 weeks, or you're in the position that I was, which is like, I'm gonna have to give all this up, which means that I had to give up my social circle. I had to give up my, you know, I got more anxiety when I had to stop running, because that was my outlet. That was my thing. And so I had to go and then create a new thing. And not everybody has that much flexibility. Running is super easy. You just have to go out your front door and go. And so if you're struggling with that, and that is where you are, and you're having to think about, you know, but this is my outlet, this is how I do self-care, this is how I take care of myself, and I'm not able to do it because of some pain, then really, really consider seeing a physical therapist. We are movement specialists. That's all I do all day. I look at how people move, and I look at how joints are moving. So I physically put my hands on people's joints to see how their joints, their muscles, ligaments, everything are moving, and then I can look at the bigger picture. So how is that joint moving with the rest of your body? And where is it that we're having a problem? And that way I can come up with a specialized program just for you, right? Because not everybody has the same problem. You know, I mean, you know that by just what type of shoes people like to wear, right? Everybody's got their own special preferences and needs. And so whatever program to help you get back to running needs to be specially incorporated for you. And it needs to address your lifestyle, your physical assessment, and what your specific goals are. So that's what I do at Your Goals Physical Therapy, is that I help people get back to their favorite activities with these specialized programs. So if this is the type of care that you're looking for, I will have a link in the notes below, and feel free to fill out that form, so I'll call you at the time that's best for you. If you're just looking for a little bit more information about maybe how I could help, I have an ebook that talks about how not to let knee pain derail your fitness goals. And you can just simply download that book and get a little bit more information. So I hope you're having a great day. Talk to you later.